Good afternoon, ladies and gentlemen, and welcome to this briefing session on cybersecurity and its consequences in public health. My name is Godfrey Schwierup. I'm the head of CSC in PAHO, and I will be the moderator for this session. We have three speakers today, and then there will be a session which is going to be moderated by my colleague, Dr. Sebastián García Saiso, who's the Director of the Department of Evidence and Intelligence for Action in Health. As has been already announced, the session is being transmitted by Zoom and is also being recorded. And there are simultaneous translation for all the participants in this session. To open this briefing session, I would like to invite Dr. Carissa Etienne, the Director of PAHO, to make her opening statement. Dr. Etienne, the floor is yours.
Thank you very much, Godfrey, and let me thank the member states reps who are here with us and colleagues. So, as I said earlier, I have convened this special session as a result of the recent ransomware cyber attack suffered by one of our member states, Costa Rica. And we are also pleased that today Costa Rica will be on the panel. And let me just reiterate the Secretariat's solidarity with Costa Rica. So although the issue of cybersecurity is not new, cyber attacks on the health sector are increasing. And it is both imperative and urgent, I think, that we be better prepared. And this is an area when we must intensify the multi-sectoral work to combat and prevent the potential incidents. I just want to give you one example. In 2017, an attack known as WannaCry disabled the United Kingdom National Health System and cost the country over 137 million US dollars. In more recent times, the Ministry of Health of Brazil and ConecteSUS websites had to go off the air after one such attack. And as a result, 50 terabytes of data was copied and deleted. According to a recent report produced by our colleagues at the Inter-American Development Bank, the health sector was one of the most attacked by hackers in 2019. And it is also the industry that has suffered the most damaging attacks in recent years. The report highlighted that the average cost of a cyber attack in the health sector in terms of business loss, prevention, detection, and recovery expenses is equivalent to $7.13 million, double the average cost of cyber attacks on any other industry. The IDB report also stressed that many Latin American countries lack the technical expertise or cybercrime laws to deal with today's threats and threat actors. And it's also stated that only 7 of the 32 countries that were studied have a critical infrastructure protection plan, while 20 have established cybersecurity incident response teams. Obviously, this limits the ability to identify and respond to attacks. Last year, PAHO raised the issue in a policy document called the Roadmap for Digital Transformation of the Health Sector in the Region of the Americas, and also in a technical guideline and call to action. But we need to really accelerate progress towards establishing the mechanisms to ensure the confidentiality, integrity, and security of information in the digital public health setting. And especially now, when many of our countries are expanding their digital capabilities. Steps should be taken to adopt regulatory instruments for the treatment and protection of sensitive health information, as well as international guidelines and security standards for patient-centered information systems for health. So really, this is a huge problem. This is about people's personal data. It's about violation of the fundamental human rights. It is about trust in the public health sector and in our response. And at the end, and more importantly, this will have an impact on the health of the peoples in the Americas. So today we have an eminent panel of speakers. Dr. Alvaro Ramos, the Executive President of the Social Security Fund in Costa Rica, Ms. Kerry Ann Barrett, the Cybersecurity Program Manager and member of the Secretariat of the Inter-American Committee Against Terrorism and the Secretariat for Multidimensional Security from the Organization of American States. We also have Mr. Ralph P. Martens, Jr., the Cyber Threat Intelligence Analyst from the U.S. Department of Health and Human Services. Let me thank you, all of those who are here and joining us virtually for this discussion. I think this threat of cybersecurity is one that should cause all of us great concern. And you just heard the discussion in the executive committee. I want again to reiterate PAHO's commitment and support to all of our member states. So now I would like to hand over to the moderator who will introduce the first speaker. Thank you very much.
It's difficult because when we're in a hybrid session like this, the room seems that it's not full, but in actual fact, we have over 90 people live following the live stream and therefore showing the importance of this event. The first speaker we have today has lived this through the last few weeks and we're pleased to have Dr. Alvaro Roberto Ramos Chavez, who is the president of the Costa Rican Social Security Fund. He has a PhD from the University of Berkeley in California and in economics, and is also a graduate of the University of Costa Rica. Prior to taking his current role as the executive president, he was an expert and functionary in social protection at the International Labour Organization in Geneva, and prior to that was the academic director at the Universidad Lead in Costa Rica. He has experience in the area of cybersecurity and is also well written in the areas of changing family structure, income distribution, and the whole area of social protection in Costa Rica. He will join us virtually, and I welcome Dr. Ramos and invite him to address this briefing session, which he will do in Spanish. Dr. Ramos, you also have control of the slides if you want from your end. So thank you for joining us, and I give the floor to Dr. Ramos.
Muy buenos días. Muchas gracias por este espacio que me han dado. Me disculpo. ¿Me escuchan?
Yes,
sí, gracias. Disculpe. Muy amable. Muy buenos días. Muchas gracias por este espacio que me han brindado. Me disculpo de antemano porque incluso conectarnos a Zoom se nos está dificultando por causa del hackeo. Hemos tenido que bajar nuestro acceso ordinario a la Internet y es bastante más complejo que antes poderse conectar. Tenemos que usar algunas estrategias vía la intranet. Entonces, bueno, ha sido sumamente complejo. Les comento muy rápido nuestra experiencia con el ciberataque. Naturalmente, como Fondo de Seguridad Social, somos un fondo muy grande, bueno, creo que la mayoría de ustedes lo conoce bien, disponemos de bastantes recursos, entonces la limitante no han sido los recursos para la inversión tecnológica, la limitante fue quizá más un tema cultural, un tema de que hay una dificultad histórica en construir un departamento de tecnología consolidado, maduro, con buen ambiente de trabajo. El que tenemos es bastante disfuncional y entonces lamentablemente esta disfuncionalidad que se refleja, por ejemplo, en numerosos cambios del director de la Dirección de Tecnología en los últimos años. Yo apenas entré hace un mes y me he llevado esta sorpresa de que han sido muy numerosos los cambios de director de tecnologías de información. Y bueno, nos ha ocurrido esta situación muy puntualmente. La gran preocupación que tenemos, y esta es la metáfora que uso regularmente, es que existen básicamente dos tipos de ciberataques o ciberamenazas. Está la ciberamenaza que está ahí trabajando, exfiltrando información, haciendo, digamos, un trabajo más de buscar información sensible que les interesa a los hackeadores, y está este otro ciberataque mucho más de traerse abajo los sistemas para esencialmente pedir un rescate por ellos. Y entonces la impresión que tenemos es que en realidad acá en Costa Rica el principal objetivo era de extracción de información, pero no tenemos mucha claridad de exactamente qué quieren hacer con esta información, porque en realidad Costa Rica ha sido sujeta de un ciberataque sostenido multiinstitucional. Primero, hace casi 2 meses, habían atacado al Ministerio de Hacienda, el cual aún no se ha recuperado de ese ciberataque, pero la reacción de los, digamos, de la entidad criminal fue mucho más lógica en ese caso. Ellos empezaron a decir, si no nos dan el dinero, liberaremos la información, si no nos dan el dinero, destruiremos la llave para desencriptar los servidores. O sea, hubo una secuencia de amenazas. Y como el país tomó la decisión de no pagar, pues entonces, naturalmente hasta el día de hoy, Hacienda, el Ministerio de Hacienda continúa muy afectado. En el caso de Costa Rica, nos pasó muy extraño en la caja porque atacan la caja, tuvimos que apagar los sistemas, hicieron mucho daño de un parque de 40.000 computadoras que tiene nuestro Fondo de Seguridad Social, lograron infectar a la última estimación alrededor de 11.000 computadoras, de un parque de unos 1.100 servidores, lograron infectar más de 900. Entonces, bueno, fue un daño muy extenso a la arquitectura de red de la caja, pero a la hora ya de amenazar con, bueno, vamos a liberar la información de los pacientes, los expedientes, los documentos sensibles, por ejemplo, de contribuciones a la seguridad social, datos de salario, nada. No han amenazado con nada. Es decir, hubo una nota de rescate que está adjunta a los archivos encriptados, pero aparte de esa nota de rescate, ninguna otra amenaza se ha dado en todo este tiempo. Entonces es una situación de hackeo que se sale un poco de la norma, porque la de Hacienda fue muy estándar. Se traen abajo los sistemas de Hacienda y empiezan a amenazar con la liberación de información. Con nosotros se traen abajo el sistema y no amenazan con nada. Entonces eso ha sido muy confuso para nosotros, que bueno, ¿cuál era el objetivo de estos hackeadores? Porque simplemente dañar la seguridad social del país parece un objetivo muy singular. Naturalmente, los daños son bastante extensos en la capacidad de proveer los servicios de seguridad social como estamos acostumbrados. Por ejemplo, estimamos que alrededor de entre un 20 y un 30% de nuestros servicios médicos se vio afectado. La Caja en Costa Rica, en una población de 5 millones de habitantes, atiende aproximadamente 50,000 personas al día. Entonces, afectar un 20% de nuestra provisión implica 10,000 personas diarias que se están quedando sin la atención médica que debieron haber recibido. Yo no quiero ni pensar mucho en lo que eso va a implicar, por ejemplo, futuras descompensaciones de pacientes que no recibieron la atención médica a tiempo, futuros incluso fallecimientos de pacientes que no están recibiendo las intervenciones quirúrgicas que requieren. Bueno, prefiero ni pensar mucho en eso porque me daría mucha cólera, pero genuinamente unos cibercriminales desalmados que no les importa nada, no les importa la salud de la gente. No sé si serán únicamente extranjeros, que es lo que los primeros indicios nos dan, o si hubo actores nacionales, pero bueno, para cualquier costarricense que sepa lo importante que es la Caja para todos los costarricenses, me resulta inconcebible que haya apoyado a estos cibercriminales, estos ciberdelincuentes. Bueno, aparte de esto, el daño a la arquitectura de red, afortunadamente, según me indica la Dirección de Tecnologías de Información, sí teníamos bastante respaldo de los archivos, de los sistemas. Entonces, en buena teoría, una vez que la red se restablezca, sí será posible volver a levantar los sistemas. El tiempo estimado de recuperación, tentativamente lo hemos calculado en alrededor de 2 meses más, lo cual está bastante en línea con las experiencias que han tenido países como Irlanda, que tardaron alrededor de 2 o 3 meses en volver a levantar sus sistemas informáticos. Y bueno, aparte, como nosotros somos una caja del Seguro Social, no solo proveemos la parte puramente de servicios médicos, sino que también proveemos servicios de pensiones, proveemos servicios, por ejemplo, de incapacidades, del financiamiento, del aporte salarial mientras una persona se encuentra incapacitada por motivos médicos. Entonces, todos esos procesos también se han visto afectados. Por ejemplo, teníamos previsto un aumento de la pensión para este mes y no lo pudimos ejecutar porque la medida de contingencia solo contempla volver a pagar las pensiones que se vienen pagando ordinariamente y es muchísimo más difícil sin sistema poder pagar un aumento de la pensión. Entonces obviamente hay una gran frustración social en el medio, para peores, de que estamos en un periodo de inflación muy elevada, no poder prever aumentos en pensiones por 1 o 2 meses. Entonces, bueno, muy compleja la situación socialmente y creo que las lecciones son, número 1, hay que tener arquitecturas de red muy fuertes, tener un monitoreo constante del parque tecnológico del país, que eso, por ejemplo, ha sido la principal recomendación que nos han hecho a nosotros, que no puede, dado que a nosotros nos atacaron Hacienda, nos atacaron la Caja, y obviamente ya solo estamos esperando a ver cuál es el siguiente ataque, si será a los tribunales de justicia, al registro civil, a dónde será, pero entonces que necesitamos este enfoque mucho más multiinstitucional, posiblemente dirigido desde el Ministerio de Ciencia y Tecnología costarricense, donde se construya una entidad fuerte de monitoreo contra los ciberataques para evitar que una situación como esta que estamos viviendo como país, sin ministerio, sin sistemas de Ministerio de Hacienda y sin sistemas de seguridad social, no se vuelva a repetir. Bueno, entonces eso muy a grandes rasgos es como el dibujo a 10,000 metros de altura. Obviamente hay un montón de detalles técnicos, pero esencialmente, como les decía, los detalles técnicos van mucho más orientados por ejemplo, de qué manera exactamente obtener software de monitoreo de, por ejemplo, movimientos anómalos en la red, de, por ejemplo, solicitudes anómalas a partir de actualización de software o de actualización de archivos del software. Bueno, ese tipo de dinámica, pues obviamente ya tiene mucho más que ver con elementos técnicos, pero el big picture, el gran panorama, tiene que estar mucho más en que los ciberataques no son aislados, los ciberataques se pueden dar de manera multiinstitucional, los ciberataques se tienen que atacar desde la perspectiva país, tienen que estructurarse medios de defensa a nivel de país y bueno, comunicar con mucha claridad que los ciberataques no se tratan solamente de robo de dinero o robo de información, sino que ha habido esta migración a daños genuinos, daños reales a la capacidad de provisión de servicios públicos de los países y por lo tanto la ciberseguridad se tiene que tomar en serio. Muchísimas gracias por este espacio que me han dado. Feliz día.
Thank you for a very comprehensive overview of the cyber ransomware attack that you just had in Costa Rica and the implications of that. So that is setting the stage. What happens when you get a ransomware attack? The next two speakers will help us in the prevention. As we always say in health, prevention is always better than cure. And we have Dr. Ms. Karian Barnett, who is the Cybersecurity Program Manager within the Inter-American Committee Against Terrorism of the OAS. She also leads the OAS CICTE's cybersecurity capacity building efforts to member states through the design, planning, and execution of cybersecurity initiatives, including the development and implementation of national cybersecurity strategies and policies, the provision of technical training to policymakers and technical public officers in OAS member states, and the establishment and strengthening of national cybersecurity incidents response teams. She also is responsible for facilitating the cybersecurity awareness tools that the OAS has developed. Additionally, she is a public speaker at various regional and international cyberspace fora with a focus on cyber-related issues in Latin America and the Caribbean. And she promotes strategic partnership between the OAS and key private sectors and international actors. Dr. Karian is also an attorney at law and possesses extensive public sector experience, given her appointments within several governments in the Caribbean as legal advisor. I would like to welcome Dr. Karian Barnett for her presentation as a member of the OAS group. So the floor is yours, Dr. Barnett.
Thank you so much, and thank you to PAHO for inviting the OAS to be part of this session. The perspective I think I would want to share with PAHO's member states are the just general considerations of what the threat landscape looks like, and some of Can you hear me now?
Can you try and speak again, Dr. Barrett?
Can you hear me now? Is that better for the translators?
Okay, good, thank you. That's better.
I'm not sure what happened. I started off by just saying thank you to PAHO for having us and for inviting OAS to be part of this session. I'm trusting that you can see my screen as well. Our goal today is just to give you an overview of the threat landscape and to tell you how, as the OAS, we've structured ourselves to help our member states to address these threats and to offer just some general guidance at the sectoral level for the health sector, things that you could consider. Regionally, as my colleague from Costa Rica has highlighted, ransomware is one of the largest threats that we're seeing in the Americas. With the COVID coming on stream, we recognize that it has become even more active, I guess. Ransomware is an active vector in our region. And a lot of this has been happening through either email attacks or what we call third-party attacks in terms of your supply chain and how you get your information and how you access your information. A lot of it, as you've heard, even from the person who introduced our panel, data is gold right now. And many of the attacks we're seeing within your sector has been related to data and data mining and ensuring that they can have this ransomware, as my colleague has explained, can come and attack in various means. Costa Rica just explained that the ransomware attack went a little bit different than other ransomware would go, where they would pretty much cripple the system. Are you able to hear me?
Yes, we hear you.
Okay. Usually with a ransomware, there would be a hijacking of the information. It would often have an evolution where they would then threaten to disclose their information. They would then consider disrupting your services. And a lot of what they would try to tell you is that they would disclose this information to your suppliers and your customers. Much of the ransomware attacks that we're seeing now, especially since COVID, is coming as a result of the remote desktop protocol, us accessing our systems virtually through our VPNs. What a lot of our institutions weren't prepared for was going completely virtual or going completely online without the necessary security protocols being put in place. Usually when you migrate to completely virtual, one of the best practices is that you actually sit with your security professional and plan for some of the contingencies that could happen. For example, backing up your data. Before migrating to the cloud, you may want to include in the cloud services certain security measures in terms of them monitoring your networks and ensuring that there are no predators, as I would probably call it, hanging around on your network seeking to find a loophole to get in. A lot of the web application attacks, similar to what was mentioned earlier, were observed in 2019 when the pandemic started. Our colleagues spoke earlier of the attack that happened in Brazil, recognizing that similar attacks happened in Argentina and in Mexico during that time. What we do know, and this is from our CSIRTs Americas network of the OAS, is that many times government emails are the source of the attack. So for example, many of us on this call may be from our health institution at the national level, and we may use our credentials, our email credentials, to access the systems for whether it be data that's being stored for persons who are actually accessing health systems, health services, or persons applying for health benefits, for example. These very email addresses and credentials that you use to access your normal email, you may use the same password for all of those other services that you use your email for. What we've seen is that government email addresses have been the target of many, many attacks. Your general emails for those who may choose, because they're working from home, as an example, to use their Gmail accounts, their Hotmail accounts, your Yahoo account to access your VPN or to access government services that you may be the chief health officer for, as an example. We see that these personalities are being targeted or your email addresses are being targeted with phishing attacks that you may or may not choose to click on, or someone within your organization may click on, which would then lead to accessing your email as well. Another thing that we're seeing is that many persons have not authenticated their accounts with activated your two-factor authentication. If you, those who may not be familiar, just to give you an idea, you may see on your Facebook account that you'll get a notification to say, hey, your two-factor authentication has not been activated. It would mean that you would not just have your primary access, which is your password, which could be 1, 2, 3, 4, 5 for some of us. And you may need to then activate what you call your second factor or secondary level security access, which may be a code being sent to your mobile phones. A lot of attacks happen because we don't have this implemented. So for example, with Twitter, they recognize that many of the attacks of persons hijacking of their Twitter accounts was as a result of two-factor authentication not being activated. This is something that is a challenge, but it's also something that can help to prevent your account being hijacked at any given time. What I wanted to show you is that even from a regional organizational perspective, there are various ways where you could support your member state. As an example, the cybersecurity program for SICTE is divided in 3 tracks. We support our member states with policy development, capacity building with technical training, and research and outreach. So putting out information at any given time that our member states can actually see what are the threats that are out there and some of the best practices that they could use to counter it. An example I wanted to give you from this that is something that can be modeled at the regional level, even for the health sector, is thinking about the different threats that the health sector would see from a 3-pronged perspective, recognizing that policy is needed for each of your institutions and seeing how this can be aligned to your national policies. So for example, the OAS, we may do national cybersecurity strategies that look at all sectors. At the health sector level, which is what we call a sectoral level, you can then begin to talk among yourselves. Do we need to have, for example, a regional cybersecurity policy that we would ask our health institutions to abide by as best practice? It may not be something that is regulated, it may not be something that is mandated, but out of good faith and recognizing that if the one is affected, the whole would be affected, you could consider something like that. Another example from using our program as a model is looking at what we call our CSIRTs Americas Network. That is a network of our incident response teams for our national level, governmental level institutions, where they would be the first responders to a cyber incident. For the health sector, a consideration could be that there is established among all the information security professionals across the health sector within each country, and then joining it regionally, to have a sectoral level regional CERT network. I'm not proposing, for example, for consideration to be done where you would be thinking about a CERT, which is the persons who would actually respond to the incidents, but information sharing at this sector is absolutely critical, recognizing the primal nature of the attackers looking for data among your networks. The final example I would want to highlight from using our program as a model is awareness raising campaigns. One of the primary persons that are the first point of entry for a cyber attack is the person behind the screen. So you and me who are sitting behind the keyboard, with the best security system that your information security person could put in, your staff and your employees are already on the inside of those firewalls. What we often recommend is that raising the awareness of your employees so that they are very much adapt to the threats that are there. They're very more conscious of what is possible, that they be more conscious in what they're doing. Finally, I would just like to do a call for action to each of you in the room to think about your national frameworks. Think about how is it that you're structured, not just at the national level, but within your own health sectors. You may have outstations, you may have various little bodies of health clinics that are everywhere. They're still gathering data. Think about how you can coordinate to ensure that they're secure. Another thing that I'm wanting to propose is international cooperation, and in this instance, regional cooperation. As SICTE within OAS, we'd be happy to continue working with PAHO to think about some regional initiatives at the sectoral level that we could lend support to. And finally, unifying our awareness raising efforts. Think about the threats that are out there. We've heard Costa Rica. How can we use their experience to raise awareness to other sectors, such as yourselves, to ensure that you're protected or have measures in place, such as backups, such as awareness raising as a defense against the attacks that may happen. Once again, thank you for this opportunity, and I hand the floor back.
Of international organizations like PAHO and the OAS to work together in hand in hand to counter this problem that many of our member states are facing. Our final speaker today is Mr. Ralph Martens. Mr. Martens has 27 years of experience serving in cybersecurity, cyber warfare, and intelligence fields, supporting various elements of the US Department of Defense, intelligence community, and the healthcare community. His military experience includes service as a US Marine in Iraq, Africa, and Cuba, as well as various US domestic locations. Mr. Martens is an adjunct cybersecurity professor at Webster University and has been published in several peer-reviewed journals. He completed his undergraduate studies at George Washington University and holds a master's degree from George Washington University, American Military University, and Harvard University. He is currently pursuing a doctorate in cyber analytics at George Washington University. Mr. Martens is a cyber threat intelligence analyst at the Health Sector Cybersecurity Coordination Center of the US Department of Health and Human Services. Mr. Martens, I give you the floor.
Okay, thank you very much. I trust everyone can hear me and hopefully see my slides. Thank you very much for the invitation to speak today. We really do appreciate it. And as you know, we are going to be speaking about some of the actions an enterprise, an individual organization can take in order to prepare themselves for cyber attacks. Unfortunately, we live in a day and age where cyber attacks are becoming almost inevitable. For many organizations, it's not a matter of if, it's a matter of when you're compromised. So preparing ahead of time, as we've heard earlier in this conference, preparing ahead of time really is key to that. So here's our agenda, what we're going to be speaking about today. We're going to talk very briefly about, very quickly, just want to talk a bit about the organization that I work for, the Health Sector Cybersecurity Coordination Center. We're then going to discuss the different types of threat actors out there. And this is important, not for just general knowledge, but it's important to understand these threat actors and their motivations, because that will relate to how each and every one of you help protect your individual organizations. And we'll get back to that towards the end of the presentation as well. We're going to talk about the big three cyber attacks that we see most frequently against the US health sector, which is data breaches, ransomware, and intellectual property theft. And we're also going to talk about some of the common infection vectors, we call them. Those are the ways in which these threat actors initially compromise a healthcare enterprise, how they get in.
Mr. Martens, if
Yes.
I can ask you to speak a little bit slower, because the interpreters, we have interpretation in 3 languages and they're finding it difficult to keep up with your speed. Apologies.
Sure can. I apologize for that. I will slow down. So we'll cover the different types of cyber attacks that are the biggest threats against the United States health sector. We're also going to cover what we call infection vectors, and these are the ways that these threat actors initially compromise healthcare organizations, because of course, it's important to understand how a threat actor initially gets in and how they follow up that attack and what they ultimately can do with that attack. And then, of course, the most important part of the presentation is the defense and the mitigations. To answer the question, what can you do ahead of time to help protect against these attacks and mitigate them when they do occur? So very quickly, I'll just talk about what we call the HC3. That's my organization, the Health Sector Cybersecurity Coordination Center. We are simply a part of the United States Department of Health and Human Services, and we are the office within HHS that helps protect the US health sector, both the private sector as well as public healthcare organizations. We provide briefs, we provide white papers, we provide different analytic products to help keep the health sector, public and private health sectors secure in cyberspace. So now let's talk quickly, very briefly, about different types of cyber threat actors. And we don't have the time to go into this in any great depth, but we do have here a basic list of categories of threat actors that attack the health sector in cyberspace. Now you can see that column on the left, we break them down into state and non-state actors. And what we mean by that, quite simply, is, are they part of a foreign government or are they something else? When we say state or non-state actor, we simply mean, are they part of a government or are they some other category? In the middle, we have a more specific description of who they are. Advanced persistent threats are governments. They're government entities that operate in cyberspace. And they are, of course, if you look at their motivation on the right, they're of course motivated by politics. So they are an extension of that government that operates in cyberspace, and their ultimate goal is politically motivated. You then have the rest of these types of actors, which are non-state actors, meaning they're not officially part of a government. So that second group you see are cyber criminal groups. They are strictly motivated by money. That is their sole purpose in life. They exist to steal as much money as possible. You have then contractors who work closely with governments, but they are technically private sector. You have what we call hacktivists, which are, it's just a combination of the word hacker and activist. So they're political activists that use hacking in order to achieve their political goals. And then you have individuals which can have any motivation really at all. We've got some examples at the bottom of this slide. We're not going to go through them, but you will have the slides. You can go through them in your own time. We will come back to that, however. So now let's talk about the different types of cyber attacks in healthcare. And fortunately, it's a good thing we've already heard about some of these in this conference so far, because we're all seeing the same thing when it comes to the type of cyber attacks that impact the health sector: ransomware, data breaches, and intellectual property theft. Now, I think we all know what ransomware is. It's simply when a cyber attacker uses an advanced form of mathematics called cryptography. They do that to scramble a victim's data and systems and networks, and ultimately deny them access to their own systems, data, and networks. And then they extort them. They demand money in order to restore that access. Data breaches within the health sector, when we talk about data breaches, we're typically talking about the theft of individual patient records. When you see the theft of those records, and there was, I believe it was Dr. Barnett, the speaker prior to me, she said it perfectly. She said something to the effect of data is worth its weight in gold, or data is gold. And that is exactly the motivation behind a lot of these data breaches. You'll see cyber criminals will steal records, patient records, from public health organizations, as well as private sector hospitals. They will steal records, and those records can be sold on the dark web. We've seen them go for as little as $40 a record, and they've sold for more than $1,000 a record. The reason why they can be sold is they're used for fraud and different types of identity theft. And if you think maybe $40 per record isn't a lot, when you think about the fact that these data breaches involve hundreds, thousands, tens of thousands, hundreds of thousands, millions of records, and in some cases, we've had some that have stolen tens of millions of healthcare records. When you start to do the math, then you see why they're so lucrative and what the motivation is behind data breaches. And then, of course, intellectual property theft. An easy example of intellectual property theft against the health sector, and we've seen a lot of this at HC3 in the last few years, is of course related to the pandemic, the coronavirus pandemic. A few years ago, when the pandemic first started, when it first broke out, when COVID first began to spread, lots of healthcare organizations, both public and private, were attempting to develop vaccines. Some countries, some foreign countries, decided that it was cheaper, quicker, and more efficient to simply hack into a foreign healthcare organization and steal that research rather than produce it from scratch themselves. So one example of intellectual property theft against healthcare organizations in recent years that we've seen a lot of is stealing COVID vaccine data. Now, I also mentioned we want to ask the question, and we want to answer the question, how do these attackers, all these different types of attackers, how do they initially compromise a healthcare organization? In the three ways we've seen this happen most frequently: phishing attacks. We've already heard about phishing attacks. They're fake emails, and they typically have either malicious links or malicious attachments. When someone interacts with one of those, when they click on the link or when they open the attachment, what happens is that by doing that, they will download malware, and that malware will execute on their system, and that will begin the cyber attack. We've also got the compromise of remote access technologies. We've also heard some great information on that from our previous speaker. We're going to go into that a little bit as well. And then, of course, the compromise of known vulnerabilities. Those are the three most prolific infection vectors against the health sector that we observe at the Department of Health and Human Services. And of course, now we'll get into the heart of this presentation. What do you do to prevent these things? How do you stop them, and how do you minimize them once they occur? So first and foremost, we mentioned one of our infection vectors was vulnerabilities. Now, it's critical to understand that vulnerabilities are constantly being discovered on all different platforms, whether it's your Windows operating system, whether it's another operating system, whether it's any of the applications that you have on that system, or it could even be firmware running on a medical device. New vulnerabilities are constantly being discovered. And not only are they being discovered, they're being publicly released by researchers. When they become publicly released, our adversaries can access them and turn them into exploits, in which case they can use them to attack healthcare organizations, and they do this on a regular basis. So how do we get ahead of this? It's very important for healthcare organizations to have vulnerability management programs. Now, we have an example on this slide. You see the vulnerability management lifecycle on the right. Now, we took that example from the United States Centers for Disease Control. There's many of them out there. We recommend this one, but there's many of them out there, and a lot of them look the same. Most of them contain a lot of the same steps, but it's just a cyclical process that healthcare organizations need to go through to make sure they understand their own infrastructure. They need to understand the systems and the networks that they have. And I know that that may seem simplistic, but it's easy as organizations grow to lose track of all your hardware, your software, and all your infrastructure that you have. So it's important to start by tracking that, ensuring that you have a process in place to track any vulnerabilities that are released related to your infrastructure, and to make sure they're tested and deployed in a timely manner. And that's what this cycle here will help you do. We recommend taking a look at it. We're not going to go through all those steps each in detail, but we do recommend making sure that every healthcare organization, big and small, has a vulnerability management program in place and allocated resources towards it, both people and money, appropriate to what they need to stay secure. We also want to talk about phishing. And again, we said phishing was fake emails. They're designed to look like legitimate emails, and they're designed to entice the victim to interact with that email, to open up an attachment or to click on a link. Phishing campaigns are launched, again, dozens, hundreds, thousands at a time. So you may have many, many employees in your organization, and your adversaries will send out many emails to lots of your employees, and all they need is one employee to interact with a phishing email. So if you're defending, you have to be successful 100% of the time, whereas your adversaries only have to be successful once. That makes this very challenging, but we have some recommendations here to prevent phishing attacks. The first and one of the more important steps is employee awareness training. And I'll say two things about this. Employee awareness training should happen for both technical folks, people who work in information technology, but it should also occur for folks who don't work in technology jobs. It should be given to both. So that's the first recommendation. The second recommendation is phishing awareness training should be given on a repeated basis, on a periodic basis, maybe once every 3 months, maybe once every 6 months, maybe once a year. That would be up for each individual organization to decide, but it should be given repeatedly. There's also other things, other steps that can be taken to protect against phishing. Filtering email at your email server, implementing endpoint security on every system in an organization, desktop systems, laptop systems, and medical devices. If you have security software running on each of those systems, you'll be more likely to prevent that malware from executing in a phishing attack, and you will stop the cyber attack in its tracks. And then, of course, multi-factor authentication. I'm sure we all know what that is, requiring people to have two different factors to access email accounts. That way, it's more difficult for an email account in your organization to be compromised and then used to launch phishing attacks against other employees. Now, we've already heard about this remote access defense, and this is great. We heard about this from our previous speaker, both virtual private networks and remote desktop protocol, technologies that use the remote desktop protocol. These virtual private networks allow all of us to access an enterprise network remotely. The remote desktop protocol is typically used by network administrators and people who are responsible for operating and maintaining the networks and the systems. But either way, they allow remote access. So we have a whole series of steps here. We're not going to go over them in detail right now, but these are our recommendations. You'll have a copy of our slides. We recommend going over these and implementing them as you see fit in order to protect and limit compromise of remote access technologies. We also want to talk about data. Now, data is especially tricky because you have to walk a little bit of a tightrope, because on one hand, you have to ensure that those people that need access to data have access to data in a timely manner. And this is especially true, but not limited to, health service providers. So if you're treating patients, for example, you might have a public hospital treating patients. They are going to need access to those patients' records in order to properly treat them. That's absolutely necessary. So you have members of a healthcare organization that need legitimate access to data, but you also have to protect that data from being accessed by those who shouldn't have access to it. So again, it's like, we call it a bit of a tightrope. It's like walking a tightrope a little bit. You have to balance it perfectly. So we have some recommendations there to prevent data breaches, ways you can design your network and operate your network. You can take a look at those at your leisure. We also have ways to protect access to data for legitimate users. And I do want to call out here what we call the 3-2-1 rule. Now the 3-2-1 rule simply says you identify the most important data that your organization has and needs access to, and you back it up 3 times. You have 3 different copies of it. You store those copies in at least 2 different types of media, and at least one of those copies is going to be stored offline. And what that will do was that will make you resilient against a ransomware attack. So even if someone attacks you with ransomware and you lose access to 1 or 2 copies of that data, you still have an offline copy safely stored, which you can then access and continue to operate or restore your operations as soon as possible. So that 3-2-1 rule, something you should keep in mind. So I want to, in order to wrap this up, I just want to quickly go back to that first chart we looked at, if you remember, when we talked about cyber threat actors. And if you remember, the first 2 categories of actors on that chart was advanced persistent threats, right? Those are foreign governments, and cyber criminals. Now, those are by far the 2 biggest threats to public healthcare organizations. Again, foreign governments and cyber criminals. And I would ask yourself this: the most important person who can keep your organization secure is you and those folks who are unique, who are assigned to your organization. You should think in terms of your organization's mission and what it has to offer these threat actors. So we already talked about very briefly foreign countries, advanced persistent threats. They may be looking for intellectual property. Do you have intellectual property in your organization? If so, who might want it? And more importantly, what will you specifically do to keep that information secure, prevent it from being disclosed? Or you may be running a public health organization that provides care to patients. And if you do, you know that ransomware operators can disrupt your operations, and then they can try to extort money from you in order to restore those operations. So that's another vulnerability you have. If you need immediate access to information, think in terms of what your adversaries are going to do to you, you specifically, you uniquely. Think through that. And if you ask yourself that question and think through that question and come to that answer, that is going to help you design your cybersecurity risk management plan. That will help you think through your cybersecurity posture and allocate your resources and set your goals accordingly. So it's a very important question, which we hope everyone will think about. I don't know that we have time right now. I think the question session will be coming right after I wrap up here, but very briefly again, we serve specifically the US health sector, both public and private healthcare, but we do have, and when we do that, we create products, briefings, and papers. We post them on that website for anyone to access, so feel free to go to that website you see on the top left, hhs.gov/HC3. Unfortunately, everything we have is in English, so it's limited there. And you can also feel free to contact us if, just to exchange information or maybe start a dialogue. You see our email address there, hc3@hhs.gov. And with that, I'll say thank you very much to everyone for your time and attention today.
Thank you very much, Mr. Martens. Very informative, and thank you for sharing your website and your email for everyone in this webinar. We have about 5 minutes so that we can give people an opportunity to go for lunch. So I'll hand it over to my colleague, Dr. Sebastian Garcia-Saiso, for this session.
Thank you, Dr. Shrev. We would open the floor with this, both online for those that are connected through Zoom and here in the room, if there are any question or any comment you would like to make to our panelists. Let me switch to Spanish really quickly. Creo que nos da la oportunidad de reflexionar un poco más sobre lo que está pasando en los países de la región en torno al camino que hemos tomado en la transformación digital y algunos de los mecanismos que son inherentes a esta transformación digital. La ciberseguridad está al centro justamente de estos mecanismos y por eso se ve reflejado también en la política que se presentó y adoptó el año pasado en el pleno del Consejo Directivo, la política regional de transformación o el camino para la transformación del sector salud en la región de las Américas, en donde están los 8 principios co-desarrollados con todos los países. Y uno de estos principios es precisamente la ciberseguridad. Se plantea esto como un mecanismo, entonces, para poder generar esta progresión segura y tomando en cuenta todos estos nuevos retos que enfrentaremos conforme avancemos y profundicemos en esta transformación. No veo ninguna... México, por favor.
Muchísimas gracias, doctor García Saizó. Muchas gracias a las personas que presentaron. Me parece que las transiciones, las múltiples transiciones epidemiológica, social, etcétera, se suma la tecnológica y es un asunto que de repente no le prestamos la debida atención en muchos de nuestros países. Agradezco mucho esta sesión, muy interesante, muy importante y que debe poner nuestro foco en ver la importancia del tema de la ciberseguridad. Manejamos datos personales, manejamos datos sensibles que deben estar protegidos con todas las de la ley, incluyendo estas acciones específicas de ciberseguridad. Muchísimas gracias por la sesión.
Muchas gracias, México. ¿Algún otro comentario? No tenemos a nadie tampoco en la plataforma virtual, en Zoom. Yo me permito simplemente agregar en este punto que estamos trabajando desde el secretariado en la construcción de un proyecto, de un observatorio para la ciberseguridad en salud pública de las Américas, que nos permita justamente entender mejor cuál es el avance que tenemos, cuáles son las opciones o los caminos que se pueden tomar y, por supuesto, cuáles son los principales riesgos que estamos enfrentando actualmente y hacia futuro con la proyección necesaria para la preparación. Aquí destaco el trabajo que Marcelo D'Agostino y el equipo de sistemas de información dentro del secretariado está realizando justamente en conformar esta propuesta y poderla presentar para trabajar con todos los países en el marco también de colaboración que tenemos con otros organismos como la OEA, por supuesto, y el Banco Interamericano de Desarrollo. Madam Director, we don't have any other comments. I give the floor to you.
No, let me say really a very big thank you to Alvaro and Kerry-Ann and Ralph. Frankly, I felt that I've sat at a lecture that I needed all my life. So thank you so very much. I think the information that you've given us has certainly opened many eyes in this room and those in the virtual space. Obviously, there's presentations that we will need to ensure that certainly our staff have access to, and I hope that this will also be available to member states, and I hope that member states will take advantage of this session to really expose their staff, both within the Ministry of Health, but also within the public sector, to what I think has been invaluable information. So let me thank you very much. We will call on you again. So thank you. So the cost of being very good is that we will ask you again to help us. But and let me thank all of those who joined us. I'm sure you will agree with me that you have today gathered a wealth of information and opened our eyes. So I know that that audit committee is here with us. We will have that cybersecurity assessment in PAO. And thank you so much. This has been wonderful. Thank you very, very much. Hasta luego. Gracias.